For an oocyte pickup, the patient is stimulated for about 12 to 14 days with either Folisurge, that is recombinant FSH, or with highly purified HMG. And then we give a trigger, and post trigger, we count 36 hours, and then we plan the pickup. For the pickup is generally a daycare procedure. It is done under short GA. We ask the patient to come in the morning about 2 hours or at least an hour prior to the procedure, nil by mouth. They have their dinner, and after that, they don't have even water. And this is a very short procedure, it takes about 30 minutes max, and it's done under short GA. We don't use any antiseptic while cleaning. We just use normal saline. And even for the probe cover, we use a non-spermicidal condom, which is a sterile condom.
This is the procedure for egg pickup, where we have kept the anesthesia ready, and short general anesthesia is given by the anesthetist with the mask over the nose. And we have a trolley here which has all the instruments, including the test tube, the tube which is connected to the needle through which we aspirate the follicles, and other instruments like speculum, Alice, sponge holder, and a few swabs. This is the suction tube which we use, suction machine which is connected to the tube, and a warmer. So I am all ready here. After scrubbing with the gloves on, I am using the transvaginal probe here, which is attached to the biopsy guide. And this biopsy guide which can have a OPU needle inside it. So you can see here. So this guide will have a hole through which I put the needle in, and I can go in and out of the transvaginal probe. So this is the ultrasound image. Now I have inserted the transvaginal probe into the vagina of the patient, and I am inserting the needle into the ovary. You can see the follicles here inside the ovary. Each follicle will have one egg, and it will have a fluid which I will be aspirating. So this is how the follicles look, and they will be roughly about 1.5 to 2 centimeters. So there will be two ovaries, and both of them we will be doing the pickup by piercing these follicles and pressing the suction button. So this suctioning out of this fluid will contain the oocyte in it, which will be checked by the embryologist in the embryology room. So one after the other follicle, we will have to put the needle inside this follicle and keep aspirating. This procedure roughly will take about 5 minutes to anywhere between 20 to 25 minutes also, sometimes when there are too many eggs. In this patient there are about 4 to 5 eggs, and one after the other ovary we do it. So this is an ultrasound machine which is extremely important. This is the suctioning of the needle that we are doing. So this is to clear the blocks if there are any in the suctioning needle. And after one ovary, now I have started doing on the other ovary, which has just about one follicle. Sometimes in PCOD patients we can even get 20 to 25 follicles also, and the quality of the egg depends on the patient. So the monitoring of the patient will continuously be happening, and once the procedure is over, we shift the patient to the recovery room. We'll observe there for 2 to 3 hours and then send them home.
These are incubators. We have 3 incubators, 2 CO2 incubators, one is dry gas.
So after the egg pickup, so we'll be after the egg pickup, we'll be retrieving the eggs, and we'll be screening the oocytes. So after the screening the oocytes, we will do the final counting, and we'll be telling it to the doctor. After that, we'll be keeping into the IVF media, and further after the egg pickup, once the oocytes are retrieved, we'll be incubating for 2 hours. 2 hours, and after that the ICSI procedure will be started.
Laminar airflow, we can call it as this thing workstation also. This is heating stage. Here we screen the oocytes. We incubate oocytes for 2 to 3 hours. Meanwhile, we process the sperm and we keep in swim up. Then after 2 hours, we denude the oocytes, and this is the micro manipulator ICSI procedure.